Hello, everybody. My name is Kylie Casper. I'm an occupational therapy student from Creighton University, and today I'm going to be talking about vision changes after a stroke. So, our objectives are going to be that after this presentation, you'll hopefully be able to identify some common visual changes post-stroke, some common age-related visual changes, and identify some newly learned adaptive visual strategies. So the first thing we're going to talk about is this visual hierarchy. And what this does is it essentially just helps us to understand different visual skills, because when we think of vision, we think of just what we can see and the clarity of it. But vision is truly so much more than that. There's a lot of aspects that it covers. And so this kind of helps break it down. And it also helps us to understand how visual skills build on one another, which is really important for being able to understand after having a stroke or neurologic injury or just aging, how these things might change and how different things might be affected. So the first thing on that pyramid was visual acuity, and this is just how well you can see with your eyes. So if things are blurry, if they're clear, anything like that. Visual fields is a space that we can see with our eyes. So just when we look straight ahead, everything that we're seeing, that's our fields. Our oculomotor skills is the ability to move our eyes in various directions. So our eyes all have muscles that move them. And so it's just how well those muscles are moving. Visual attention is our ability to maintain our focus on a fixed spot. So to be able to look at something and stay focused on it. Visual scanning is moving our eyes in a coordinated fashion. So you use scanning when you're reading a book or looking in your environment. Pattern recognition is being able to understand and follow patterns. So kind of similar to when you read left to right, you're using a scanning pattern. And then visual memory is being able to look at something and recognize shapes and forms. So kind of just being able to look at it and be able to remember what it is just based on seeing what it is. And then visual cognition is putting all of these skills together and using them in a functional way. So going about your life and using your vision to help navigate the world around you. So some common visual changes post-stroke. According to the American Stroke Association, approximately 65% of stroke survivors experience vision changes or problems after a stroke. So it's really, really common. One thing that you may have heard of, you may be experiencing, is what's called neglect. And so this is basically when you don't visually respond to or and aren't aware of things on your affected side. So if you're working with someone who has neglect, or maybe you have neglect, it's kind of like your brain just forgets that that side is there. So whether it be left side or right side, say it's left side, your brain just kind of ignores and shuts off the left side. And so you really have to use a lot of adaptive strategies to kind of overcome that problem that you may be having. Field cuts. And so remember, field cuts is the area that we can, or fields are is the area that we can see with our eyes. So you may have a field cut, which is a loss of some of the area that we can see. So the individual just might see black on the left side or the upper side. It just kind of depends on what's going on. And then there's a couple of different eye movement disorders that can commonly happen. So you might have what's called strabismus, which is where your eye kind of rests in an abnormal position. And that can be due to some of the musculature in your eyes becoming imbalanced. You might have issues with oculomotor dysfunction, and that just can lead to difficulty with tracking and scanning. So being able to move your eyes in a controlled, coordinated fashion. And then you might have what's called nystagmus, which is when your eyes kind of rapidly jiggle, and that can lead to double vision, dizziness, things like that. And then also dry eyes are very common. That can lead to irritation, blurry vision, burning. You might have depth perception changes, and that can impact your balance, your coordination, and just kind of your vision as a whole. You might have double vision, which is also called diplopia. And then something else that can happen is what's called a scotoma, which is a blind spot in one or both eyes. So now we're going to talk about just some common age-related visual changes, because as we age, our eyes change just like the rest of our body, and our ability to perceive that vision might change. And so it's important to understand how our eyes might change anyways as we age, alongside those things that may happen after a stroke. So one thing is losing the ability to see items close to you. A lot of people, as they age, might have to get glasses to help with that. You might need increased time to adjust to lighting changes. So like when you go outside and it's really bright, your eyes might need more time to adjust. You might have difficulty distinguishing colors. So colors that are kind of similar to one another, like navy and black or red and orange. And then there's something called age-related macular degeneration. And so these terms are just kind of, I'm throwing them out there because they're things that you might have heard of or that you might hear about, and just want to make you familiar with them and kind of what they are. So this is a loss of central vision. So the picture on the left does a good job of demonstrating what that would look like for someone who has macular degeneration. You can also have diabetic retinopathy, cataracts, which are cloudy areas in your vision, or glaucoma, which can lead to total vision loss. And then again, dry eye. So again, like I said, the goal of this is to just kind of throw these terms so they're just become a little bit familiar to you. And so then maybe if you hear them, you're going to say, oh, I've heard that before. And then all of these things that we just talked about can result in what's called low vision. So low vision is eyesight that cannot be fixed with glasses, contact lenses, medications, or surgery. So some examples of having low vision and how that can impact you might include trouble reading, you can't see well enough to do daily tasks such as cooking, or difficulty recognizing faces of familiar people. So when someone has low visions, there's some strategies and adaptations that we have to utilize that can be very helpful. And we're going to get into that in a couple minutes. But next, we're going to talk about things that you can do to help keep your eyes healthy. So get your eyes checked regularly, protect your eyes from the sunlight, and wear sunglasses and/or hat when you're outside. Follow a healthy, nutritious diet, monitor your blood pressure, stop smoking if that's applicable to you, and then control your diabetes as well as you can if you have it. Okay, so now we're going to get into these strategies. So we're going to kind of take this area by area about your daily life. So first, we're going to talk about dressing. First thing you can do is hang and organize your clothes by color. Use small boxes within drawers as dividers to help organize items, just to keep everything more consistent and easy to find. And then place high contrast tape on the back of only one of your shoe in each pair to tell left from right. So maybe take all of the right shoes that you have, place a piece of like red tape or a bright colored tape to the back of that shoe, and that can help with distinguishing when you pick up a pair of shoes, being able to tell what one's the left one and what one's the right one. And then with bathing and hygiene, use high contrast items such as a dark bath mat to distinguish from the tub. So during this half of the presentation, we're going to talk a lot about contrast items, because that can be, it's a really easy way to be a very helpful solution. So anytime you're doing anything, try to get items that are opposite colored from like your built-in fixtures. So like bathtubs are usually white, right? So get a dark bath mat. You can add large print labels to your shower items to make them easier to identify. And then you can use a magnified mirror for shaving or for makeup. And then we're going to talk about cooking. So this is definitely a big area that there is a lot of things you can do. So again, use a high contrast cutting board. So like we just talked about, if you have a dark counter, get a light cutting board. It's just going to help you to be able to see it against the background a little bit better. Keep items in the fridge and in cabinet in an order that feels natural to you. So, excuse me. So when you're going about organizing your kitchen, put everything in a place and in a sense that feels normal and natural and makes sense for you. Use utensils, plates, and cups with high contrast along with a cutting board. And then you can mark appliance dials with what are called bump dots to help identify commonly used buttons easier. So this picture on the left has bump dots on it, and what these are just kind of raised little plasticky dots, and they come in several different shapes, several different sizes, different colors. There's square shape or square, circle, anything like that. They can be red, black. So lots of variety depending on what you're needing. But basically, what they do is they provide both a tactile, a touch input, and a visual input so that when you're feeling around, say on your microwave, you have even more of a chance to be able to say, okay, I know I put the bump dot on the 1 minute mark. So when I'm feeling and I feel that dot, I can just push the dot. I know that I'm hitting my 1 minute mark to put the time on. So those are really, really helpful modifications. You can buy bump dots, Walmart, Amazon, anything like that. They're very affordable. And then you can also mark oven dials with high contrast tape to help see them easier. So taking like a red piece of tape and taping it to your dials to help make sure that you can look and see, okay, all the pieces of red are facing up and down. So I know my dials are off. And then another thing I don't have on this presentation is dial covers. So just those plastic covers that you can place over the dials to help make sure you don't bump them and accidentally move them. And then also you can use the microwave or like an air fryer if you're feeling unsafe using the stove or oven. Reading and writing is next. So the first thing is going to be this, it's basically called a line isolator. The fancy name for it is a magnetotyposcope, but it's this picture on the left. And what it does is it helps you when you're reading something, you place this on the page and it helps you to isolate one line at a time. So where this piece of plastic is that's yellow, it can either be highlighted yellow like this one, or it can be clear. And then that glass also acts as a magnifier. So what it's doing is it's blocking out, so you're only reading one line at a time. It's magnifying that line to make it bigger, and then you can have the highlight on it like this one does, or just not have it. You can buy those at Walmart, Amazon, any of those types of stores. Using bright tape at the edge of a page to help you to make sure that you scan to the edge of the page. So if you have any like neglect, that's a very, very important strategy because as occupational therapists, when we work with people who may have some visual neglect, we are constantly trying to reiterate scanning and head turns. So to try and compensate for that visual deficit that is happening, or encouraging people to turn their head to make sure they're seeing their whole environment. So placing a high contrast indicator at the edge of the page can be helpful to make sure that you're getting all the way to the edge of the page. You can use an e-reader like a Kindle, anything like that, so that you have more control over the font size. And then you can use a magnifying glass for reading. So kind of just one aspect of that picture right there, just using a plain magnifying glass. Use paper with bolded lines when writing to help it be easier for you to see the lines. And then using bold pens when writing, so using like a bold black pen. And then you're able to purchase large print like address books, calendars, checks, things like that. So those can be very helpful as well. Managing money. So when it comes to managing money, it's important to organize your important papers in different colored trays or folders with labels. So maybe you'd make every time you get a water bill, you put it in the blue label or the blue folder, or anytime you get an energy bill, that goes in the green folder, anything like that, whatever system you can identify to help work for you. If you're able to, you can pay your bills online to allow some more ability to modify the font, make it bigger. Again, using large print checks, magnifiers, those types of things. Find a system to fold paper money in different ways to help identify them. So maybe it looks like every time you get a 1, you fold it in half long ways, and every time you get a 5, you're folding it in half short ways. You get a 10 and you fold it in half twice, whatever you can do. And then if you're at like a store, anything like that, and you're paying with cash, ask the cashiers to verbally tell you what value of coin or paper money that they're giving back to you so that you know. Managing medications. So you can label your prescription bottles with large print labels or different colored tape. You can mark your bottle caps in large print with identifiers. So maybe it looks like taking your blood pressure medication and writing a big BP on the top of it, anything like that. And then other strategies that kind of don't fit into these previous categories are, like I talked about earlier, scanning. So making sure you're turning your head to see your whole environment. Using dark colored light switches and electrical outlets to increase contrast against walls. So because most people have lighter colored walls, so using darker colored items just to help it stand out more. And then adding, or if you don't want to get darker colored ones, you can add like bright colored tape around it. Motion lights that turn on when you're entering a room. Lighting is so important when it comes, I mean, just for general safety in the home, but especially if you're having difficulties with any aspects of vision. So making sure that you are in a environment that is very well lit. That can look like making sure that you have all of your light bulbs in your house up to par. You can add lights under your cabinets to make your countertops brighter, adding motion lights that turn on when you enter a room, night lights, anything to help reduce any risk of not enough lighting. You can also use clocks with large numbers and phones with large font. And then adding colored tape on the edge of stairs to identify where they start. So that is a very helpful tip, because a lot of people may struggle with being able to identify where the floor ends and the stairs start, because oftentimes they're the same color of floor or carpet, anything like that. And then when you're going to do grocery shopping, try and make your list according to where items are found in the store to like consolidate your trip, make it a little bit easier. Or there's options out there for online shopping and just doing a grocery pickup. There's grocery deliveries. Some stores have available people in the store to help you shop. So lots of modifications. You would just want to talk to your local grocery store and see what all they offer. And then just trying to make your home a very clutter-free, easy to navigate, and safe environment. So who's there to help when you have visual changes? You can visit your doctor, your optometrist, and occupational therapist can help provide adaptive strategies similar to ones in this presentation, but also ones that are more specifically tailored to what you're needing. And it's just important to remember that proper diagnosis and rehabilitation can help recover and improve performance in daily activities. And then here are the references. So thank you so much for watching. If you have any further questions about visual changes after a stroke or as you're aging, or just questions on stroke recovery in general, you can contact us at the American Stroke Foundation. So you can visit our website, www.americanstroke.org. You can check out our YouTube for more information, or our Facebook page at American Stroke Foundation. You can contact us on any of those platforms, and we'll get back to you with your questions. So thank you for watching.